Hello, Dr. Mills. This is my presentation slash video reflection on somatic disorders and some of the orders that are kind of related to them, like conversion disorder, eating disorders, and some sleep disorders. So right off the bat, somatic disorders are thoughts, could be described as thoughts, anxiety, or energy spent on your symptoms that you are experiencing. And what a somatic disorder is you are feeling like you cannot shake your symptoms. You have excessive worry over your symptoms. Sometimes it can be intentional, sometimes it can be unintentional. But yes, that is a somatic disorder. The causes of somatic disorders are trauma and neglect of some kind, a lot of times seen in childhood. So another somatic-like disorder is elimination disorder. Elimination disorder is shown in two different ways, through enuresis and or encopresis. Enuresis is urinating, and it's basically just bedwetting or using the bathroom, not in the bathroom. Typically seen in most cases. My brother actually had this. You see it in adolescence. You cannot diagnose it before the age of 5 because all little kids just have problems going to the bathroom at the wrong times. But we can see it as early as kids that are a little older than 5 years old. It can be seen in adults, but when it is with adults, when it is seen in adults, it is comorbid, typically with another disorder such as dementia or aphasia. Elimination disorder could be embarrassing for a kid or a person, and it is important when treating that to not be hurtful, embarrassing. I think actually my parents had my brother wear diapers when he was past the right age, and then that actually probably was the wrong way to handle that situation, because that is kind of embarrassing, humiliating, and it makes him feel bad about probably a clinical disorder that he had. He got over it. But it's important when treating just to have an understanding, when you're treating someone with this disorder, give them an understanding of how they should prepare to go to bed, what they should do in order to go to bed, and treat them just using cognitive behavior therapy. The next disorder, group of disorders I would like to talk about when in relation to somatic disorders is that of eating disorders. A couple of eating disorders that were seen in the videos are anorexia nervosa and bulimia nervosa. And a lot of people just say that the difference between the two is people who are bulimic throw up whenever they think they eat too much, and people with anorexia do not. That is untrue, because it is really just the difference in the thought process. People with anorexia believe that they're overweight when they really are, in fact, underweight. People with bulimia nervosa, however, are more of binge eaters, and in some cases they might be slightly overweight or the right weight, but they binge eat and they go on splurges where they're just more guilty about the way they look, and they just hate the way they look, whereas an anorexic person is just, they have a distorted perception of their weight. Someone with anorexia they could eat, like bulimia, they could vomit up food, but not as much seen. They excessively exercise, they excessively restrict calories. They have a very similar mindset to OCDs because they have the same abnormalities in the brain. With both disorders, women are affected almost as 10 times as much as men. Anorexia is actually the most deadly mental disorder, with 20% of the people diagnosed end up dying either, because with bulimia and anorexia, there are oftentimes a plethora of health complications that go with it as a result of not being malnourished and not eating enough. Treatment for both would be nutritional counseling, cognitive behavior therapy, and in some cases, in these cases, a combination of cognitive behavior therapy and medication is appropriate. People that live with anorexia or bulimia disorder are always very self-conscious about the way they look. They don't like the way they look. It might be coupled with social anxiety. Oftentimes is comorbid with, in cases, borderline personality disorder, and of course, as we were talking about, obsessive compulsive disorder, OCD. The last disorder, group of disorders I would like to discuss in relation to somatic disorders are sleep disorders. Sleep disorders, there's a few different ones, insomnia, narcolepsy, etc. Also, sleep apnea is another very common sleep disorder. Insomnia is basically the inability to go to sleep, where everybody has difficulty going to sleep from time to time. Insomnia becomes clinical when it is a kind of a somatic trend where someone is just overly focusing on not being able to get enough sleep. They have sleep anxiety. With narcolepsy, and other disorders like that, it's more of a circadian rhythm problem and more of a problem with the person's routine when they sleep. Both disorders can be treated with medication, but cognitive behavior therapy and a mixture of medication is best. It is best to, when treating a sleep disorder, using benzodiazepines and other psychotic medications that induce a haziness, sleepiness, are best to be prescribed for a very short amount of time, because benzodiazepines, you get used to them really quick, so you build up a tolerance, and it is really easy for people to abuse them and become reliant on them. So treatment for sleep disorders is using cognitive behavior therapy and educating people on the circadian rhythm and how to have proper good sleep and have a better routine at night to get to sleep better. People that have sleep disorders, it can be very miserable. You can have people become very agitated, they become very fatigued, muscle weakness, and then obviously we see narcolepsy could develop. Yes, so that is my presentation or video reflection on somatic disorders. Thank you.